That's pretty amazing.
Well, so on that, that's awesome. And you said you were 30 years
This
practice.
year.
So tell me, I guess, a little bit of your background
Okay.
and then how you got started. Because I know the women's hormone is your everything. I think your
Well,
focus. Again.
I I I've been a nurse practitioner again, and I practice in acute care for
Okay.
most of the time. And then I started interest in functional medicine about 10 years ago. Kind of
Okay.
did that on the side for
Mm-hmm.
fun. And then probably about 3 years ago, I just was inspired finally to see if I could do this on my own because of the necessity to teach people to become their own leadership in their health. Um, People, this is a pretty smart demographic. You don't just tell them what to do. You need to tell them why and what's at stake. And people want to know that. I mean, even in the information age, when you can do your own homework,
Right.
people still want to know like how to apply that in the spectrum of concerns. So,
Sure.
so that's what we do here is provide a lot of education. Our clients here have a big investment of time because we have are basically their first encounters with us are an endocrinology 101 for them.
Okay.
You can't just like give women patches and prescriptions and say, "Hey, I'll see you in a year." It doesn't work that way.
Mm-hmm.
The 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 gold in there is the follow through. The symptom profiles for
Mm-hmm.
women and men are completely different. The dose necessity is different for
Right.
everyone, and so following through to figure out, how are you doing, and to teach women like what the symptoms of estrogen hunger are versus
Okay.
symptoms of testosterone hunger and progesterone hunger. And so if you can coach them to know what that is, then it also quiets the voice on their shoulder telling them they're crazy, especially
Okay.
because there's a lot of hormone symptoms that are happening between 30 and 50 that can't be quantified. And they'll talk to their doctor in some transparency about all the subjective symptoms. And um, the doctor said, well, your labs are fine.
Right.
And it's maddening because they think, well, it just must be me. It
And
must be something wrong
and
with
that's the
me.
kind of thing that's made
Yeah,
you take a little bit more of a
yeah,
functional approach
that's right.
to endocrinology, which I guess for anybody who doesn't know, the functional typically seems to be more on the cause versus traditional medicine typically is more focused on the symptoms. Would you say, is that a
Yeah, that
reasonably
might
fair statement?
that's an overgeneralization, but fair.
Sure. Okay.
But
Yeah.
it's fair.
We don't want to
It's
say
definitely
there's nothing
fair.
wrong with traditional medicine.
Sure.
It's just there's
Right.
two different ways to look at it, especially
Right.
like with endocrinology, and there's nothing wrong
Yeah.
with that. But
And I've been that provider.
sure. Okay. So that
So
gives you a
I've been
very
that
unique
provider.
perspective.
So I've been that provider, and so we don't like throw anybody under the bus, but it,
Mm,
it does matter. And
yeah.
there's an industry issue too about seeing more patients, seeing them faster, and productivity that's hurting healthcare in some ways.
Right. Because
So
it's just a
yeah,
numbers game, right? Like you said, you
in a
don't
lot of
get to
ways, right?
spend all the time. And you just
Yeah,
said that your goal is to try to do endocrinology 101. I mean, you
yes,
don't just want to say, here, take iodine. You have to
yeah.
understand,
Why?
why am I taking
That's
iodine?
right. It matters, and so you have to
Great.
know what's at stake, and the rationale for that. People, taking supplements, for instance,
Yeah.
it's a long game. There's not
Sure.
always a lot of positive reinforcement for taking that
Mm-hmm.
vitamin D and your iodine. It tastes terrible. And
Right.
so, but
Wow.
if you knew what was at stake and you had that investment of time, then you could follow through with that,
Certainly. Well, the
long
body's the
term.
temple. I
Yeah.
mean, I think
Yeah.
from what you've told me and what we'll touch into next with the topic of today is
Uh,
if people really understood what's at stake on these kind of levels, that it might be
yeah.
taken a little bit more seriously. Like, for example,
Yeah.
even though Mountain Dew, that's so hilarious,
Yeah.
and yellow Gatorade, I don't know if you knew that.
Well,
Like,
you knew, right?
it's a bit more of like I don't know if I ever want to drink that again,
Mm-hmm.
which
Who knew?
who knew? So, with the functional endocrinology, do you focus a lot? Today's topic is on women specifically.
Yeah.
And then within that, birth control.
Yeah.
I know you've got a lot of good information on birth
Yes.
control. So, first off, I guess just for those who don't know the hormonal birth control, can you give me an idea? How does it work? For
So
all the guys watching that don't understand
okay.
this.
So every woman has, an egg development, and
Mm-hmm.
that happens in a menstrual cycle in the middle about,
Okay.
and the eruption of the ovary from this cyst that generates every month erupts an egg, and
Mm-hmm.
then that erupts, and there's about a week long period, that
Okay.
you can actually conceive. And so, what birth control does in the most generic form is it hinders ovulation. Simple as that.
Simple as that.
Yeah, hinders
Okay.
ovulation. And so, it also hinders the ability of the uterus to bloom this endometrial layer of a
Mhm.
nest for pregnancy. Um, there's, for the most part, the two big players
Mhm.
are hormones estrogen and
Mhm.
progesterone.
Okay.
There's some second fiddles there, but
Right.
the two big players are estrogen and progesterone.
All right.
And one of the things that we've learned in this practice is that there are so many women. It's not a matter of if you start having progesterone hunger symptoms. It's just a matter
Okay.
of when. And um, what we found is that as we teach women what the value of their body's progesterone, they have an epiphany of like, well, how do I raise my progesterone? Because it's so important, which leads into, well, how does that apply to birth
Mhm.
control? So, to help these women understand what's at stake when we turn down our progesterone, I kind of have to tell the story of what progesterone does.
Yeah.
Um, and then apply that to birth control. So we'll start there.
Yeah. Let's do that. I think
Okay.
get a kind of good overview.
Yeah.
Uh
And it's a great way to do that. So if this were a menstrual cycle on a
huh.
female, and this orange were estrogen,
Mhm.
and this green were progesterone.
Okay.
So this is a menstrual month.
Mhm.
Progesterone is kind of quiet here in the beginning,
Mhm.
but estrogen, which by the way has about 300 jobs in the body, and
Right. Yeah.
most of them are actually above our waist. Most of them, and they're
Interesting.
into our brain.
And if I'm not mistaken, men have estrogen as well, but in
Yes,
very
they
small
do.
components.
That's exactly
Okay.
right. They do. It's very vascular protective, in fact.
Now there you go.
So,
All right.
so I don't even like to call these sex hormones because
Okay.
um, they have far more implications above our waist than below our
Gotcha.
waist,
Okay.
and they are life hormones,
Interesting.
and so they're indicated for more things than just reproduction. But anyway, so
All right.
that's
So
it.
on this
So
chart.
estrogen here in the beginning of a menstrual cycle, estrogen is rising. If we
Okay.
were checking blood tests on a woman, we
Mhm.
would have double digit number here,
Okay.
triple digit number here, and then
Mm.
double digit here.
Okay.
And so below the waist, estrogen right now is blooming and blossoming this endometrial layer that makes a
Right.
nest for pregnancy
Right.
and preparing for that.
Mhm.
We're fertile and have the eruption of that egg right here in the middle.
Boom. Okay. So when we have
So
the high point of both.
exactly.
All right.
So if your ovary erupts the egg from here,
Mhm.
and from that same casing where the egg erupted is called the corpus luteal cyst, and it generates this huge pulse of progesterone. And
Gotcha.
so that's why this surges right here.
Bang.
Now, what progesterone does below the waist,
Mhm.
right there, is it um, counters this endometrial blooming and puts some protection to that, and it's a counterpoint so that this blooming doesn't exceed
Mhm.
what's necessary.
Okay.
Um, Now, in this hour, women are in their fertile phase. There's several days.
So
What
okay.
progesterone is doing in these hours, in these days, um, during this fertile week, is it's saturating GABA receptors in the brain. If women pay attention to that, what that feels like is their skies are bluer. They're in
Okay.
their best mood of their whole week. They're in their best mood. Their skies are bluer. Their attention is better. They unload the dishwasher like Snow White. They whistle while they work. They have higher libido and they're winking at their partner. That is the operation of progesterone. Now, if we checked her serum value right here,
Mhm.
it would be, a bold, between maybe 10, 15, or 20. Now, if a woman gets pregnant right here,
Okay.
that serum value is now about to increase by 10 times and go to the sky to a triple digit value of at least
Right.
100. Pregnant women are the poster child for what progesterone does for a woman.
Right.
So what
Okay.
does that mean? They have so much GABA stimulation in their brain from progesterone.
Yeah.
What are they? They're super sleepy people.
Right.
They are, but they don't have depression.
Yeah,
They don't
there's
have
like a glow. Like you said, there's all these
glow.
weird things that you can kind of just look at someone and
Say,
somehow say
who's
they
that?
look pregnant, or like in a sense they could be pregnant.
It's
Like
the
they're
glow.
super happy. They glow.
Yeah, it's the
Okay.
glow. They don't have anxiety. They don't have depression. They don't have obsessive OCD type obsessive behavior, irritability.
Hmm.
They also don't go in the dark, dark hole in their mental state. That is progesterone doing that for them. So now, subsequently,
Hmm.
that said, which is kind of a segue into this, many women, they live with their progesterone super high. When they deliver, their progesterones go back to before. And if these progesterone values don't rebound, there it is. There's the mechanism for postpartum depression. Unfortunately, it's just not, it's a progesterone deficiency. It's not treated typically with progesterone. It's treated with an antidepressant,
And
which
is that a natural kind of phenomenon post-pregnancy that some women suffer?
it's
Just
very common.
Oh, very common. Okay.
It's very common.
Okay.
It's very common. But sadly, it's just not treated with progesterone. It's usually postpartum depression is usually treated traditionally with SSRI or antidepressant, which is not fruitful. Why? It's not the upstream cause of the problem. It's a receptor not being occupied. So that said, it's functional medicine that is saying, listen, progesterone doesn't have the clinical indication for insomnia, but it should.
Right.
It doesn't have the clinical
Right.
indication for depression or anxiety or premenstrual migraines, but it should, because it does all those things. So go back to this diagram.
Yeah.
So say a woman's in her fertile week.
Okay.
Her progesterone's high or
Yep.
estrogen's high, but she doesn't conceive.
Right.
Well, naturally, her progesterone starts to fall. When this withdraws below our waist, it destabilizes the nest, literally,
Right.
and it breaks down and it falls and literally becomes an next period.
Gotcha. Like
right?
I say, falls apart. Okay.
Falls apart.
Gotcha.
So now, but it also withdraws from our brain.
Now, so is that progesterone decrease what we're all from the male community here
Go ahead and
familiar
say it.
with? Just
Yes.
Okay. Gotcha. I think, but yes, those few
There it
days
is.
where we avoid.
Be careful.
Be careful. That's a
Tread,
good way to
tread
put it.
lightly.
Yes. Okay.
I don't put your money on anyone but her.
Good advice. It's good advice.
Yes.
So now you can give
Yeah.
the actual we know.
Yeah. So that's what that looks like. So
Okay.
it withdraws. So we have this is in young women, this 24, 36 hour or more window where we have this unexplained irritability and daggers fly out of our eyes and we and might be weepy. That is progesterone withdrawal. And so that said, progesterone is the benefit of ovulation.
Right.
Now, that's only part of what progesterone does is help our mental health. Guess what? Women on birth control have no progesterone. They're on not progesterone, they're on a synthetic referred to as progestins of different kinds.
Now, reference into this chart. So if a woman in this example was on birth control for quite a while, what would this same line look like? So if there's no progesterone, is the progesterone, so it's flat. So you're just getting the estrogen spike and then down. And then obviously no ovulation because you're on the birth control.
They have a progestin. They have this. Now there's some birth controls that actually have estrogen in the beginning and then a progestin like following that, and there's some that have equal amounts of both steadily, and there's some birth controls that are progestin only. But all of them are going to require progestin, and what that does is it renders our progesterone to be zero.
And what would be the symptoms of a woman that has zero progesterone?
Well,
I mean, I'm sure there's a lot, but I guess maybe the top. If I was going to self-diagnose myself and I'm like, gosh, I'm taking birth control, I've been told that this is all normal, but I don't feel so good. What would be your advice to be like? What are the top few things that I would need to look out for?
Well, it's very subjective.
Oh, okay.
It's absolutely subjective and hard. It's meaning hard to quantify. But there are a lot of women who have been labeled with ICD-10 codes for, at the worst, bipolar disorder.
Oh,
at the lightest, anxiety disorder, depression disorder with irritability. And where they usually land is in the mental health medical scenery.
Sure.
And but no one has suggested to them that it's simply because that all they need is progesterone restored to them.
Okay.
And no one has ever maybe suggested that this is everything to do with your progesterone being zero. In the worst case scenarios, there's some women who they go on a birth control, and I hear these women all the time.
Yeah.
And they within 30 days they realize that I'm not myself. I'm just simply not myself. And they
Wow.
recognize that, they're self-aware, and they go off this stuff, and within 48 hours, they feel like they're back to their baseline.
Okay.
The unlucky women are those who have been on birth control since they were children in their
So
teens.
like 16 maybe.
Yes.
Okay.
And so they have never had progesterone on their side. And in
Wow.
their camp, they weren't self aware in the first place,
Right.
at that age.
Yeah.
And so by the time these women are in their 20s, mid 20s, and definitely 30, there are so many of them that are already have been placed on SSRI, or even a series
Mm.
of them over time, trying to create a reality that is simply being robbed from them. And it's an industry issue too, because the terms progesterone and progestin are often used synonymously in the
Yeah.
industry.
Let's talk about the
Yeah,
differences because there clearly is
yeah.
one.
Yes, there's
So
just
what?
one. So progestin was generated in the early
Mhm.
60s and 70s.
Yeah.
It was the best that we had. It was the
Okay.
what was available for the counterpoint hormone that was generated, and we didn't have progesterone available to us until 1998. So even in
Mm.
the old WHI data that started in the 90s, when you had the countering hormone, what we used was simply progestin,
Okay.
and that was what was appreciated as equivalent. Unfortunately, you will hear um, your gynecologist say
Okay.
that the birth control has progesterone in it. It's not progesterone.
Okay.
It's not progesterone. It's not. It's progestin, and it's absolute synthetic. So it's not a mistake. So let me just go back to this diet for a
Yeah.
minute. So talking about the role of progesterone in
Hmm.
mental health.
Yeah.
Um, it the other things that it does is far more dynamic than just mental health
Mm.
long term. um, we know that women who have more months of their life that they ovulate and therefore
Okay.
more progesterone have
Right.
70% less breast cancer.
Imagine that.
Imagine
Yeah,
that.
that's wild. Actually,
We
that's now. Is there any data to show since we introduced birth control into the system that breast cancer increased?
Well, that's a great
Or
question. I probably have that in the
okay,
archives.
it's
I probably
something. Yeah.
do. But we also know that those women who have higher
Mm.
progesterone over their lifetime have 540% less breast cancer in their
Well, that's
lifetime. It is not a
pretty
mistake.
substantial.
It's not a mistake. That it's not a coincidence that those women in that WHI study
Yeah.
from the 90s who were on a progestin
Mm.
are the ones that got breast cancer. That's not a coincidence at all.
Mm.
So it's very breast protective over a lifetime. All of my patients that I see here that are post breast cancer and recovering from that have all had progestins in a dense volume of their lifetime. And the later in life that they have that, the higher the risk. And so now, so what I find is
Mm.
that we're supportive of our clients who choose birth control, of course. But when they
Right.
discover what's at stake,
Mm.
when they render their body's own progesterone
Right.
zero, and that this is such a compromise,
Right.
so many of them say this. They, it's such good news to them to be validated.
Sure.
Yeah,
Yeah,
they're
I can only
validated for
imagine.
the first time in their life because they have been struggling with their mental health. We're not talking about psychosis, although
Right.
that's a possibility.
Different from the
But
back end of that curve.
yes, but we're talking about women who are struggling privately and silently, and
Right.
they're not finding support. We have clients who, now that they know this,
Mm.
they decide, if I had known that, I would have chosen something else. But if I had just
Okay.
known, but they really thought they were taking progesterone, and it's a mistake. It's a gross mistake. Um, the industry is rampantly using that. I've had clients just last week saying that, oh, she's learned about progesterone and she
Mm.
would love to, eliminate that
Sure.
IUD, that Mirena, which is
Right.
covered in progestin.
Okay.
Progestin,
Which is a hormonal
which is
form of birth control.
exactly.
Okay.
IUDs, not all IUDs are coated with progestin. Not all of them are. The
Okay.
Mirena is, the Kylena
Okay.
is at a much lower dose.
Right.
There are other IUDs that are copper IUDs that do not have hormone at
Okay.
all. Um,
And you had this patient. You said this, or she was learning about it.
yes, and so
Okay.
she discovered, oh, I would I want to have my Mirena taken out, and I want to get some on progesterone for all of its benefits. And her gynecologist told her, honey, it's the same thing, and it's not the same thing. It's absolutely not the same thing.
So maybe another good question then is, so if you've got gynecologists, which for this subject is like as a woman, I imagine, is like your main source of information, and you're going to your gynecologist to figure this stuff out. What is the difference? Why does progesterone not suffice? Why does it not work?
Well, you mean, why does it not work? It does work.
Well, I say, as far as you were saying that progesterone has all these benefits, and then people are saying, oh, progestin, it's the same thing. And obviously it's not. What makes them different? Why is it?
That's a great question. I think it's that the industry has the answer. First of all, progestin preceded progesterone historically. Not in the body, obviously.
But it's been around longer.
But it's been around longer. That's right. It was the thing that we had. It's what we built birth control out of.
Gotcha.
Progesterone really wasn't available until 1998. And it has to be micronized, meaning it has to be, a small molecule, a small molecule.
Small molecule, these smaller doses. Then,
not smaller doses. Particle. That's the word.
Particle.
It has to be a smaller particle to be available, bioavailable. And so progesterone came on the scene later, historically.
Right.
It did. And so, but also, let's just be honest. No one's making money off progesterone. It's not a profit maker. It is bioidentical. It's not going to be patented.
Right.
And you can get progesterone commercially available, mass produced for $20 a month. So that's an industry issue. And birth control is going to be, progestin is going to be a profit maker.
That's very interesting.
Yeah. I've had, and there's more problems in the industry that I had, we have some incredible, it's called the menopause, hormone elite women who are doing such a great job of showing how WHI data has been debunked, and that older women need to be fearless of estrogen. It doesn't cause disease. WHI data has been rescinded. And these are gynecologists, females who have gone through menopause, and they are heroes and re-educating women and recreating the paradigm about fear of hormone replacement therapy. But they're also in the industry. And so they will even equate progesterone and progestin and tell women, oh, sure, you want to keep your Mirena? It's got progesterone on it. Of course you want to keep that. In fact, there's so many benefits. In fact, I take my oral progesterone at night, and it just helps me with sleep and anxiety. Right. Of course it does. Of course it does. But the client that she's talking to does not share her benefits of that. Doesn't get to share her benefit. In fact, it's much more likely, because she has this imposter invading that receptor where progesterone belongs, that they are in a crisis, more likely to be in crisis in their mental health, where progesterone could be. But going back to that subject of for those women of ours who look at their birth control choices, they feel like, wow, this is such a big deal. What can I do for my mental well-being? There's one thing that all women have in common. They want their mental well-being in place.
I imagine so.
There's birth control, no matter where you stand on the issues, they all want their mental well-being in their best interest.
So you're saying that even if I'm in that stage, I can still come talk to you, and you would still say, hey, we'll keep you on that. That's okay. I understand. But we can also get you on the right levels of your progesterone.
Well, I'm glad you said that, because yes, they can come talk to us. But the problem is they should be able to talk to anybody about it.
Right.
They should be able to talk to anyone about that. But that is not the first line drug of choice for mental health. And of course, I want to quantify and say this. We're not talking about everyone on progestin recognizes this problem for them. There are a lot of women who just feel like they're prosper on it. But this is meant to be good news to so many women who are struggling with their mental health. They've been told they're fine. They're not prospering on SSRI. They've had false hope with outcomes of that. And I'm going to say something else that sounds somewhat like bravado, because I love the data and we love the studies. But being a nurse practitioner now, 30 years, um, and I'm not the only one saying this. All my psychiatry friends are saying it as well. We are supportive of people who take SSRI. However, never in my career have I ever had a patient admit to having just a huge breakthrough in their mental health as a result of
Yeah.
SSRI. And so when I challenge women, it's like, listen, just judge the fruit of that.
Mm.
Um, because we don't want to pull people off of SSRI. We don't want to do that.
It's a rough
That
experience.
is something, doing that abruptly is not healthy. It's dangerous. So, but the introduction to progesterone, we just have so much outcomes about
Yeah.
how much more wholesome this is. My colleagues in psychiatry are saying the same thing. The tools that they have in their tool bag. I have several friends, and of course, they're all saying the same thing. Mandy, if I tried to apply progesterone in my sphere of influence
Sure.
in their medical uh, catechism,
Right.
their peers would just, run them off as though because it's not considered a first line drug of choice for mental health. But
Yeah.
so clearly, so who needs more progesterone? Well, women over 40 because they have, they're not ovulating consistently,
This is like
right?
kind of pre-menopause then, is that the
Exactly,
okay?
exactly.
All right.
And this is the perimenopause. They call it no man's land.
Okay.
This is something that happens to women as early as 8 years before they go through menopause.
Okay.
And the most common age for menopause is 51 and a half. And
Right.
if you start perimenopause 8 years before that, what does that look like? That looks like a woman who doesn't have this benefit. She starts bleeding quite a lot. She'll tell her
Mm,
doctor three things. She'll say, my periods are 10 days long
interesting.
and I can't control that. In fact, and not only that, but my kids. I love my kids, but they are pushing my buttons. They are pushing my buttons, and that's just not like me. At
Mm,
work last week, I bit somebody's head off. I don't know what that's about. And then thirdly, they'll say they simply can't sleep as well. And this is a generalization that we see every week in our clinic. These
yeah.
these women in their 40s, they go to their doctor and they simply explain the scenario, and they're given three options. They're given sleeping medication,
Right. The
and
pill.
they're given offered to go back on birth control to control the bleeding.
Ah,
And
and then
they're
we're back to
even if they finish growing their family, they're offered birth control, whether from Mirena IUDs
mhm,
or birth control,
yeah.
and they're getting a little estrogen from that for those few hot flashes in perimenopause that they're periodically experiencing. So it
Yes.
seems to be like perfect thing. You stop bleeding, but
Right.
why? And they're given usually an antidepressant of some kind. So three pharmaceuticals, and all three of those are nothing more than progesterone
They're
100 across
just
the board.
kicking the can, right? I mean, because you're really not. You're just treating the
Right.
symptom versus saying
Why?
why is this
Exactly.
happening?
Exactly
This
right.
is our functional approach
And
versus the more traditional. Oh, you're not having problems sleeping, sleeping pill. Oh, you're bleeding more. Here's birth
birth
control.
control.
Right,
Right.
like where we actually want to figure out what's going on. Now,
Right.
if the woman who's starting this hasn't necessarily maybe was on birth control, like you said, has had their family,
Mm-hmm.
maybe they haven't been on it,
Mm-hmm.
would you expect them to have could possibly lower levels of the progesterone? Like, does the progesterone recover naturally without birth control? So if someone gets off of
Yes.
birth control and then maybe over 10 years go by prior to the menopause, would progesterone recover on its own?
It certainly can. I
Okay.
mean, take for instance, how many women can get pregnant when they stop birth control? They can't get pregnant until they ovulate. So we
Mm,
know the body wants to do that. And
right.
when you take the disruption of that axis away, the brain and the ovary want to talk to each other. And
Sure.
so, of course, they do. Now, it's not uncommon that women have been on birth control an extended period of time,
Mm-hmm.
and there's an infertility that follows that because
Mm-hmm.
it takes some time to maybe regenerate that.
Right.
What are those variables are unknown, but infertility is a broad subject. But that said, unfortunately, the same industry that will often say, you want to beware of hormone replacement therapy because it's
Mm-hmm.
risky, is
Right.
the same industry that will place a 40-year-old on a progestin birth control to control
Mm-hmm.
her bleeding and actually put her at risk with low progesterone
with all
for
of the
breast
thing.
control
Yeah,
for breast
for
cancer.
cancer, everything else that we've
Yeah,
talked about, the mental health, like you said, just
yeah,
being not
yeah.
yourself, feeling worse across the board,
Right.
not good in any way. There's one more thing on the birth control because we've got this question a lot. So those are the hormonal options,
Hmm.
and obviously, like you said, you could take that and we could supplement
Hmm.
progesterone. But as far as non-hormonal options, so if there's someone that says, I'm after hearing this, I
Hmm.
don't want to touch anything that's
Sure.
hormonal, I'm smart and maybe I just want to see what my, again, we go back to that
Mm.
education that you talked about. What
Yeah.
are my options? What are some other non-hormonal
Well, of course,
options?
we mentioned the copper IUD is definitely
Okay.
non-hormonal,
Yep.
and of course, there are barrier methods that are non-hormonal. But I'll tell you, it's really exciting. One of my favorite things about
Mm.
20-year-olds
Yeah. Yeah.
is that they question everything, and it's
Yeah.
to their benefit.
Yeah, it's good.
And so that's a great thing.
Mm.
There are options now where you can actually use indicators with urine
Okay.
for luteinizing hormone to determine when you're in your ovulatory phase. That's amazing. There are
Yeah.
also apps that you can use for free apps to um, actually
Just
track
to track the cycle,
track your
essentially to
cycles
track
to track
this.
your
Okay,
cycles.
so we know
How
then.
much more wholesome is that? So it requires some responsibility,
Right.
right? It does require
There's some effort
responsibility
there.
for sure, but certainly worth it. What's at stake,
Right. Yeah.
right?
Golly.
But our demographic of people, they're just really brilliant people, and if
Yeah.
they only knew what was at stake and giving them those options, it's life changing for them in every way, for the better, not for the worst.
Mm.
And but also exciting are apps that are connected to indicators, like for instance, an aura ring. If you've heard of these brands
Oh
that
yes.
actually judge a woman's, for those women especially who have irregular cycles, that this is more difficult for them to discern, that are
Wow.
checking their temperature and tracking that, and will actually the apps on their phone using their aura ring can tell
Yeah.
them when they are most likely to conceive and give them warnings. And so fascinating options out
Side
there.
question here, just based off that, would progesterone, could that affect the regularity as far as like you said, some women are having unusual? What would be some of the main causes of something like that? So even if you're aware of it, is there anything that?
Meaning,
Yeah. So if you said you might have a woman that's having, like you said, irregular cycles, and it's
uh-huh,
difficult to track. What would be
yeah.
some of the things that could be causing that, and is it even related to progesterone or these hormonal birth controls? Is there any link to that, or is it
Well,
completely separate?
when there's a lot of women, so birth control actually, you'll hear this term all the time called
Mm.
regulate your period.
Yes, I've heard that.
It's the three-word phrase.
Right.
A young woman, she's only been menstruating for a few years.
Mm-hmm.
Her periods are painful.
Right.
Why is that? She's not yet ovulating regularly. That means
Okay.
that she has maybe
Okay.
she's her estrogen is
Mm.
bold, but she's
Mm.
not ovulating. You only the ovulating ovary generates progesterone, so
Okay.
she's not on this regularly ovulating yet. She
Mm.
has bold estrogen. She may have more endometrial bloom that she needs.
Mm.
She's Our periods may be uncomfortable
Right. Sure. It
because
makes.
she's more
Yeah.
engorged from that
Okay.
endometrial blooming,
Yeah.
and so in distress with that gynecology,
Mm.
will say, let's do this. Let's regulate your
Okay.
period. And
So
it seems like it's going to help that.
yeah.
It's going to decrease endometrial blooming
Uh huh.
and therefore decrease volume of their period and they on progestin,
Mm-hmm.
and that will make the period feel better. And
Right.
it'll regulate, become more
You're right.
regular. It'll be right on time.
Treat the symptom.
Exactly. And so that regulate your period catechism
Mm.
has placed more women, young women, on birth control
Right.
in the name of, you
Just
know,
leads us down that path that
this,
we
and
just
there it
talked
is,
about.
and there it is. But not only that, could
Mm.
these young women benefit from oral progesterone? Yes, they could.
Well, this would be my question
Yes,
too
they
on
could.
that, is if you were talking to the mom who has just
Mm,
brought their young daughter and who's
uh,
complaining of all the symptoms that you've just
mm,
talked about because they're not hitting the full cycle. But what would be your advice? Because I know, like you said, they're probably going to go to the gynecologist,
sure.
and we know that most of the time the gynecologist is going to
Regulate.
regulate the
Yeah,
period,
yeah.
right? That's just what it is.
That's the tool in the tool bag.
The mom that's read about this or come across something like this,
Mm-hmm.
what would be your kind of treatment advice, or advice to the mother and the young
Okay.
girl? What would be,
So I would say that, listen, there's decades of precedent
mm-hmm.
that is going to validate their decision at that time in history,
Yeah.
that this is just what you do. Right.
Right.
And
Okay.
so they're going to be very likely to
Mm.
be less skeptical of that. But I'm going to invite them to listen to what's at stake. Now, we also know when estrogen is high,
Mm.
estrogen excess, which is very common in younger women,
Mm-hmm.
also causes something that we refer to here as the B's: bleeding, bloating, breakouts,
Okay.
breast tenderness, and bitchiness. Nobody wants that.
Yeah,
So,
well,
okay.
I like that it's medical. It's good. It's good.
So, that said, mom's concerned about her behavior.
Right, I'll imagine.
She there there's some issues there.
Yeah.
Now, what moms need to hear is like, it's going to be okay. She's
All right,
fine.
that's good.
And it's not only a possibility of their estrogen excess, but there's also a progesterone hunger as well. And to have a collaborative conversation about, mom may have other concerns besides just Pumpkin's painful period.
Right.
She's worried about her behavior.
Sure.
And she's worried about her daughter getting pregnant. And
Right.
so, and she's worried about her mental health.
Yeah.
And she's adopted this belief that if we regulate the period,
This all goes
it's
away.
going to get better.
Right.
And that's not necessarily true.
Right.
If you had a correlating conversation about that and knowing what's at stake, then of course the parent is an influential person. Then they would say, listen, maybe we want to revisit that as well. And maybe progesterone is the answer for the painful period. Maybe progesterone is also at least temporarily, for a season.
Yeah.
Maybe progesterone is an answer for the irritability that is
Right.
that's happening.
Any of the B's.
The B's. It's a helpful for bees.
Well, and it sounds like too let's talk about how you would actually get progesterone. So we've gotten all this far. Progesterone is key, and I'm now say, gosh, I want to try this. It seems like the side effects are pretty low. It's something that I've got naturally. How do I go about finding a place, and what could I expect? How is this going to be administered?
So the progesterone in the oral form is not a fatigue reliever. It actually makes you sleepy, right? Because it saturates GAD receptors. Right. So this is something that you would take at night. It has an immediate release. It makes first pass through the liver, and then you have the sleepy benefit. It's not a drunken experience, but it's certainly something that on the rest of the daytime, you live off metabolites of this 5-alpha, 5-beta, pregnenolone, and so forth that help with daytime angst, with nighttime sleepiness. So the first thing we would do is start with the oral progesterone at night, and in younger women, we would probably just treat them on the second half of their menstrual cycle.
Okay.
And cycle that. And so in younger menstruating women, very likely we just simply need to cycle that and help them to regulate that cycle as a way of regulation instead of that. Yeah. Now, make no mistake, progesterone is pregnancy supportive. Progesterone does not make you ovulate. Ovulation.
My next question is, Mom is saying, wait a second. So you're going to make this easier for Pumpkin to get pregnant. So you're saying that that's not the case, right? So we're going to help the bees, but we're not going to make you like a fertile machine.
That's right. Okay. Ovulation makes you have progesterone. But can you supplement progesterone without ovulation? Of course you can. And you should. There are other women who have other anovulatory, non-ovulatory syndromes. Many women with PCOS, polycystic ovarian syndrome, it's really an insulin endocrine issue. They're not ovulating very well. These women have to be supported with progesterone. So
now, on a side note, if that's are they treated with progesterone? Like if someone who has that goes to their traditional doctor more times than not, are they given the synthetic, or
they're often given birth control. Given birth control.
And does that? So I know I'm going to ask, but for the person maybe that has that, told, treat it. You're on birth control. Does the birth control typically kind of fix those problems, or do we see the same pattern of just kind of kicking down the road?
Well, what birth control offers to women who have PCOS and or even endometriosis is they have this estrogen blooming, and so the birth control and the progestin provides the counter to that because they have estrogen dominant FG, which is kind of a misnomer, but it does suppress the estrogen aggravating symptoms. Now, have we done a good job of using progesterone as a first line option to look to that as a first line choice? It's not used for that. And so, but it, it could be.
It seems like
Probably
the other
should be.
piece of this from everything that I've taken away is it's just not going to hurt. I mean, like,
You're right.
yeah, but so it's even, it sounds like it's even safer for the girl who's saying, gosh, maybe I should give this a shot. I mean, it seems like I've got nothing to lose.
You really have nothing to lose to try. It's so clean. It's so wholesome. It's something that your body makes. When your body is optimized, yeah, when your body's optimized, this is what it does, and it's meant to do. And our concern in this practice is that it's not used as a first line drug, and that there's so many women who have been chronically discouraged about their mental health and had no idea that the lack of progesterone was there was an issue that was so obvious. And so who needs more progesterone? Well, every woman after age 40 needs it for the rest. And then women who have anovulatory states like polycystic ovarian syndrome, and then women on birth control. They went on birth control.
So, Mandy, with everything that we talked about progesterone, learned a lot. How can a woman increase their progesterone naturally on their own without anything else?
The best way to give yourself better progesterone is to let your ovary ovulate if you can.
All right.
Then the second way is to take it in an oral form, possibly. You can receive it in a cream form transdermally. You can place it under your tongue, and there's lots of different ways to do that.
Are those also both prescription options?
They are.
Okay.
They are.
So we have to meet with someone.
Correct.
So obviously, if it's probably not going to be your gynecologist.
It may not be, unfortunately, because again, it's not a first line drug of choice for mental health.
Where's the next good place to look for someone maybe in their area? Maybe a women's.
Sometimes your functional medicine.
Okay.
Yeah, functional medicine is, like I said, is really the voice that is the loudest right now. It's not beholden to the industry of pharmaceutical.
Right.
It's not. And so they're the camp, I'll use that word, the camp who is acknowledging that, like I said, progesterone doesn't have the clinical indication for premenstrual migraine, but it should, because the drop of progesterone is a trigger for premenstrual migraine. It doesn't have the clinical indication for depression or anxiety, but it should. It doesn't have the clinical indication for insomnia, but it should, especially for middle-aged women and beyond. So all of these applications are just not well appreciated because, again, without being controversial, it's not very profitable to the industry because, as we covered, yeah.
Now, on the non-hormonal side, so like you said, the best way would be to allow yourself to ovulate.
Yeah.
And if you said, well, but I still want to be on some form of birth control. So if you're on a non-hormonal birth control, obviously, if I have this right, you still allow yourself to ovulate, correct?
Yeah, that's right.
So if you want to do that, but you say, gosh, that just sounds kind of risky. I don't know. If that's, I've been told different things. What would be some good options like rhythm or like you said, some of the strips, maybe something, what that process looks like? Where do you start?
It looks like education. Okay. Something that you can do in your privacy of your own home, education. I mean, go to YouTube, right, and learn about natural family planning, about the rhythm method. Especially this is easiest for women who have a predictable schedule. There's free apps that you can download that can help women learn how to regulate this, and so much you can self-educate. But even for those women who have irregular cycles, there again are devices that can be worn attached to by Bluetooth to your phone to show women like when they're having this temperature change consistent with an LH surge that's consistent with ovulation, so that they can judge when those times are that they're more fertile than others. And when women can have their own progesterone, and there's, like I said, there's one thing that all women have in common, no matter where they are in their knowledge of birth control options. They all want their mental well-being to be optimized. And so, unquestionably, this is, meant to be what we know about progesterone that's just not been made common knowledge.
Right.
It's meant to be liberating for women to know, have the epiphany of like, oh, that's what we want women who hear
Right.
this lecture to say is like, oh, what an epiphany! To it makes sense now, and that's what that's about.
And then one more little question here on that. So that's with on the female side. Obviously, on the male side of things, because it seems like after it takes one time to look at the piece of paper that comes with side effects for the birth control, and it's hard to even say you should put this in your body. Are there any other natural things or other ways that male, on the male side to help prevent, besides like condoms or anything else that can on the male side that can be done to your knowledge? And
on the natural side, to
and,
prevent pregnancy.
Yeah, is there anything else? I mean, hormonally, is there any?
Well, I understand that there are hormonal birth controls for men that are coming up on the industry. I would say red flag. Red flag.
I've learned, I'm gonna just
red
don't know anything about them, but that's a scary thought. Okay.
That's a scary thought. Just red flag right away.
For women, it's probably gonna mess up the body.
This is going to be an overgeneralization, but birth control has proven that when you alter the axis between the brain and the gonadal organs, whether that's testicles or ovaries, there's going to be a compromise in your health, and it's not just below the waist that happens.
That can affect your thyroid, your adrenals, right? Because those are all connected.
Well, yes,
right?
Yes, in general, yes. Specifics to be determined.
Okay.
But yeah, you cannot separate thyroids and ovaries. You can't separate them. All the endocrine organs are on a circuit board. Thyroid, breast, adrenals, ovaries, testicles, prostate are on a circuit board, and you can't separate one from another without them all being affected.
Well, it sounds like then. So there's obviously progesterone, there's non-hormonal options that seem to be pretty effective. It seems like not only does there's some effort for the woman, but especially if they have like a partner that can help them manage it. So like on the male side, buy the thing, help them keep track of it. Don't be an idiot. Like I say, if you're gonna. I mean, it seems like from what you're telling me, if you got two reasonably intelligent people, well, I'm just saying, two reasonably intelligent people, that this should be a pretty easy way to figure this out. To figure it out. I mean, to do non-hormonal and then not have an unplanned pregnancy, because obviously, like I said, that's the main fear for this.
Sure, I mean,
makes sense.
And I've got skin in the game. I am not childbearing age, but I have 4 children, all of childbearing age, all with spouses who are interested in doing things for their well-being. Sure. So, and they're looking to do what's the best thing in their situation. So, I want to support them as well and help them to make good decisions. And so, I'm invested.
That's good. You got anything else? That's done. We got to let you go.
I got my time.
Let us do like any sort of intro type deal, or you can. No, I think we just started it rolling.